We should mention also, you teach other doctors the procedure. You are a university professor, I guess, at the most prestigious medical schools, top medical schools in Philadelphia.
Well, Philadelphia is known for its good medical schools. I have the privilege to be on the faculty of 2 of them. I used to teach medical students, but now I teach residents who really do not get this training in their residency.
Hair transplant.
Hair transplant is very unusual.
And what do you call it, by the way? I mean, in your lingo, do you guys call it restoration, hair transplant surgery?
Well, hair restoration encompasses the entire field.
Okay.
That is, it could be medical. It doesn't have to be surgical.
Like alopecia, things like that?
Well, for someone who's just starting to lose their hair, for example,
okay.
we may not need a surgical intervention. We may approach with a medical intervention, such as minoxidil or finasteride, especially in a younger patient. But so that's hair restoration. But when we decide surgery is necessary or desired, then it's hair transplantation. That's the technique we use. But we use a whole palette of techniques.
Now, you've done about 16,000 cases.
Yes, I've done about 15,000 plus. I stopped counting at 15,000.
All right.
I thought that was sufficient.
Are you that much better now? I mean, is this one of those things that there's a big learning curve? I mean, are you that much better at creating a natural hairline than you were 10,000 cases ago?
Yes. I think, first of all, you need an innate talent to do it. You need an innate creative talent. So you'll find a lot of hair transplant surgeons do a lot of other things. For example, I'm a drummer. I work with my hands, and so I think this came natural to me. And it's something you can't learn. If you don't have the talent, you can never learn how to do an artful transplant. You can do a good technical transplant, but it's the artful transplant that separates the great hair transplants from the average transplants. But I've heard people who take it not seriously. Surgeons who are good surgeons, they may be plastic surgeons or general surgeons, they say, if I can take an appendix out, I can do a hair transplant. No, that's not the case.
They say things like that?
They do say things, and so they already have missed the point. Hair transplant isn't about taking out an organ. It's about a fine detail to the skin and the scalp and the angle of the hair. And it's not all about taking something out and stitching it back together as quickly as possible before the anesthesia wears off. It's delicate work.
Why do you like it so much? I mean, when did you know you wanted to do this, by the way?
I always liked it. I always liked it since the first time I saw it, and that's going back pre-1990. But the techniques back then were not refined enough for me. That was the days of the old plug techniques.
Okay.
And there's no way I would do that to someone. And I joke with my patients, because they ask me, why did you go into this field? And I tell them, well, my one grandfather was a barber, and my uncle, and my other grandfather was a blueberry farmer. So therefore, I like to grow hair. I like to grow things. And maybe it's true, but the truth is, I don't know why I like it. I took a liking to it, and I started to do it, and I became very good at it. And I started to love it, but then I really started to love it when I found out that you not only do it, you make people happy.